If you have agoraphobia, you know it's a very debilitating condition. And if you've done some research on it, you probably know that exposure therapy is usually one of the most recommended treatments. I'm Megan, a licensed professional counselor, and I wanted to talk through some common misperceptions people have about exposure therapy and some tips for the common obstacles people tend to face when they first try it out. So one of the first myths I often see people think about exposure therapy is that essentially it involves like facing your worst fears right away, and that you basically need to be super nervous and either having a panic attack every time or at this incredibly high anxiety level, which is completely untrue. What I usually will recommend for people when you are first thinking about exposure therapy, don't kind of just do it willy-nilly. I often recommend trying to do it really progressively and create a plan for it so that you're not overwhelmed. I often recommend starting with a big goal you have, whether that's being able to go to a concert with friends or being able to attend like a social event, and break it down into as small of a step as you possibly can, just continually working up. So don't start by just throwing yourself into the most anxiety producing situation you can think of. Think of what is the smallest step I can start taking towards this goal. Maybe that is just leaving the house for 10 minutes at a time and walking around the neighborhood. Maybe that's taking a quick drive up to the local park and staying there for 15 minutes. Maybe it's getting in the car and seeing if you could drive 10 to 15 minutes away from home and then coming back. Work your way up to each of these kind of situations and places you want to be able to work through instead of trying to throw yourself in. In terms of having a panic attack every time, so this is a misconception. Exposure therapy is meant to be challenging. You are meant to face your fears, and eventually you may experience panic attacks as part of normal exposure therapy. However, just experiencing them and forcing yourself to that point of panic is not the point. The point of exposure therapy is to slowly build your confidence over time and to basically help retrain your body and your brain to kind of realize that these activities and these situations are inherently safe, and to kind of work through some of those self-limiting beliefs. Eventually, as you face bigger and bigger fears, sometimes it is typical to experience a panic attack because you are putting yourself in situations that can be triggering. That is not a deal breaker, aka you don't have to always stop doing your exposure because you're getting a panic attack, but it's also not the point. You don't need to push yourself to that point. However, if it does naturally happen as you're facing usually some of those really top fears of, your exposure goals, the point is to kind of sit through it, to see if you can stay in that situation, in that activity, not fight the panic attack, wait for it to remit on its own, and then be able to show your brain and body that you are still safe, that the panic attack didn't prevent you from necessarily doing what you still needed to do, that it isn't inherently super dangerous and needs to be kind of fought or prevented, and that you can still maintain that activity and still maintain being out even after having a panic attack. So it's not the point, but it is common to experience them. I just encourage you, don't push yourself to the point of having a panic attack. It's not helpful. It's not going to make your exposure results any better. Sometimes it naturally happens, and our goal at that point is to not let it stop our progress or stop our activity longer than, of course, naturally we kind of need to experience the panic. But it's not a goal, so you shouldn't be forcing yourself to the point of near panic attack levels of anxiety. If you notice you feel like doing the exposure on is pretty much near that panic level every time, it could be a great sign for you to actually slow it down and break whatever goal you're doing on into smaller steps. So if, my goal is to go to the grocery store by myself and I'm noticing that I am getting a panic attack in the parking lot of the grocery store before I even go in, it's too nerve-wracking, that's probably a sign that it is a little too early for me to achieve that goal, and it'd probably be more useful to start smaller. Whether my goal is maybe to go to the grocery store with a friend or close family member, maybe it's to go in the grocery store but not buy anything and not talk to anyone. Maybe it's just to go outside the grocery store and back home, right? You can break that goal down into as many small pieces as you want to eventually work your way back up to going to the grocery store alone. But if you're consistently experiencing super high panic levels every time you go to try to do that activity, it's usually a sign to start a little smaller and work up and build your confidence up that way. every so often, again, like you may just wake up in a more anxious mood, and it's normal for sometimes there to be that high level of panic while you're doing exposures. But if you consistently notice every time I go to practice this, it just feels so overwhelming and too much and it makes me want to give up, try going smaller and working your way up after a few weeks and after you've built up the confidence of trying something a little bit easier. Another myth I often see when people first start doing exposure therapy is almost just the idea that once I face that fear, it should kind of instantly become easier and I should be able to move on. Unfortunately, that's just not the reality when it comes to exposure therapy. It needs a lot of repetition. So even if I was finally able to get to the grocery store on my own, I may notice it still feels very scary. It often requires me to practice it time and time again, usually 10, 15, 20 times before my brain fully accepts that this is a fully safe activity and I may be able to move on to kind of a higher level goal. So if you notice, hey, I did finally do this, but it's not instantly better, just know that that is extremely normal and it's not a sign to give up, just a sign that you need to continue to practice doing that until you notice it gets easier over time. If you notice, even though I've practiced this 15, 20 times, it's still hard, this may be a good point to look at if you're engaging in any safety behaviors while doing your exposure therapy that might be limiting your progress. So those would be things like either taking a fast-acting anxiety medication right before you do any of these activities or right after. It could be even just keeping your anxiety medication immediately on your person so you feel like, it's safe only because you have that medication on you. It might be like the fact that, I have my cell phone, so if it's really bad, I'm just gonna call my family member to come pick me up, right? That I have an easy out for this. It might be distraction. You might be purposely distracting yourself the entire time you're doing that situation. Any of these types of behaviors, you can Google safety behaviors for agoraphobia, but anytime you're doing it, it can really limit the progress you kind of see long-term because it's essentially teaching your brain that you can do this activity, but only if you're doing X, Y, Z to keep yourself safe. And if you were to ever stop doing that, it would be impossible and you won't be able to do it. So make sure when you do practice, you are experimenting with trying to limit these safety behaviors as much as possible. And it should really help your practice actually be a lot more effective because it's going to teach your brain that you can handle doing this on your own. That being said, of course, if it's between you going to the grocery store with your medication or with a safety person and not going, be sure to go and use the safety behaviors, but just make a plan so that every so often you're limiting it, right? If I go to the grocery store the first 3 times with my friend, maybe the 4th time I try to go on my own. But I have, my cell phone and I know, my friend's ready to pick up the phone. But that means 6, 7, maybe 10 times in, you probably should be trying to go on your own, maybe without your cell phone in your pocket if you're able to. So just keep that in mind when you're practicing. It's a common thing that people kind of disregard and often results in you having to do way more practice and having to repeat an exposure so many times because you might be engaging in all these mental and physical safety behaviors while you're practicing. So those are some tips. Give it a try. If you have any difficulties, leave it in the comments below. See if you can get some help in regards to overcoming some of your obstacles you've had to exposure therapy. But just wanted to provide some advice. If you still need help, be sure to maybe look out exposure therapists. You can use Psychology Today or just Google and find a exposure therapist near you who can kind of help guide you through it and can personally go through it with you so you can see and they can help you identify if there's any safety behaviors or if there's any issues with the way you're doing exposure therapy.